It depends on what you're injecting, and it also depends on which areas you're injecting. I find that if I inject with the proper technique, slowly and gently, I really diminish my risks of bruising. Also, when I use ice, when the patient uses arnica beforehand and afterwards as well, that really also cuts down on the risk. The other factor, though, with bruising is the area that you're injecting. When I inject Restylane in the tear trough area under the eyes, that's an area that has a lot of blood vessels, and that's an area that bruises, unfortunately, more often than some. Around the mouth is another area that sometimes bruises, not as often as under the eyes. So the marionette lines in the lips, sometimes you get a little bruise. Another area that bruises is the cheeks, when I inject to volumize the cheeks. There's a lot of blood vessels underneath the skin here, and it is possible to get a bruise. The nose bruises fairly rarely. However, when I'm injecting in one particular area, which is right in the middle of the bridge, to raise a bridge or define it, that area can sometimes bruise. However, other areas of the nose, such as the tip or the very top of the nose, what we call the radix, very rarely bruise. So whenever you're getting filler injection, there is some risk of bruising. How much of a risk depends on where you're injecting and what you're injecting. So discuss it with your doctor to make the best plan for you.